If you want to record me anytime. I don't care. So, right, just do it. If you want to do it, do it. If I'm doing something stupid, don't record me. So like the other night, I'm sitting there watching TV with my son and I'm falling asleep. So I'm doing this. And the little son of a bitch recorded me and put me on Snapchat. So apparently I'm a Snapchat phenom. Look up my son and you'll see all the stupid things that I do. He records me at the gym, like if I'm lifting weights, and you make funny faces sometimes, right? I'm sitting there doing curls, I'm like, "Ugh." So he puts that on Snapchat, it's great. Okay. So you guys are starting to panic a little bit about the practical, and I get it. So from this information today, you're not going to get a scenario that says, auscultate the right middle lobe. It'll say, perform auscultation of the chest. And as you're going through it, and you're placing your stethoscope at the various locations, I may say to you, I want you to make sure that you auscultate over the right lower lobe, superior segment. Okay? So what am I going to be looking for as someone who's grading you is to make sure that you know where that is. So if you were to put your stethoscope, what did I say, the right lower lobe, superior segment, and you put it here.
Partial credit.
The likelihood of you failing a practical from putting it on the left side is not likely, but you're not going to get full points for it. Agreed? If you put it here, do you think that you're going to get full credit? Because the superior segment is named for where it is. So what you should have done was visualize, okay, where is that fissure that separates the upper lobe from the lower lobe? Well, it runs from T2 to T4. So I'm going to find his inferior angle. I'm going to find his spine of his scapula. That fissure line is going to be somewhere here. I'm going to put my stethoscope right there.
Do you want us to verbalize that? Or can we kind of just go on?
No. Remember what you're told. As an example, auscultate the chest. I am going to say, hey, where are you right now? And if you say, I'm on the chest, no bueno.
Does auscultating the chest also include the heart sound?
It may, but it may just read, perform auscultation of breath sounds. We're going to go through examination tomorrow. This may make more sense to you tomorrow, okay? But I wanted to just address the panic that's starting, okay?
Are we going through a mock, like, is that going to be going through a mock practical?
I mean, I'll try if we have time, but basically your mock practical is whatever we're learning in lab is things that you should be able to do. So far, what have you learned in lab? You learned how to auscultate the heart. You learned how to do exercise tests such as an Austrian rhyming or a YMCA protocol.
6-minute walk.
6-minute walk test. A step-up test.
Use the Doppler.
You learn how to use the Doppler, right? So they're all, and again, it won't be, hey, just use the Doppler. It'll say, evaluate a patient for arterial disease. And that would be one thing that you could do, okay? Now again, you only have 10 minutes to do the examination. So for example, you might be told to perform the YMCA protocol for someone who's in phase 2 cardiac rehab, outpatient cardiac rehab. Well, you only have 10 minutes to do it. So you're probably not going to be able to get through the whole thing. Now, let's say you start them off at 300. No, you won't even have it. I'm going to give you the protocol. You don't have to memorize the protocol. So if I give you the protocol and you put it at 300 kgms or 2 kps, right? 1 kp is 150, right? You're going to lose points. Agreed? You're probably not going to fail it for that. What gets you guys in trouble is safety. Okay? Remember, one thing we do is we work inpatient. We work with patients who are in hospital beds. We have to get them up out of bed, right? So if you're told, perform inpatient assessment of someone who just had an MI, and you're told, they need moderate assistance to perform bed mobility, and you sit them up and you walk away from your patient, you see how that's a safety concern? that would be an example of kind of an easy failure. During the YMCA protocol, you have to accurately record what heart rates and blood pressures are. So if I'm palpating and you're palpating, and I palpate a heart rate of 104, and you tell me it's 76, that's telling me that you're unsafe. Now, what's going to happen during the practical, if in fact that happens, I'm going to give you a cue. You might want to do that again.
And don't panic.
It's easy for you to say that now. It's easy for me to say it. I don't want any of you to panic, but my point is I'm going to give you a chance to do it again. But realize this, there's only 10 minutes. So you can't keep trying and trying and then, well, eventually you get it, but you haven't done anything else. Okay? Yeah.
Would we have to, you know, saying we have to record, would we have to record everything and then try to find their VO2 max as well, or is it just the skill we're looking for?
Well, again, you only have 10 minutes, so the likelihood of getting through a full YMCA would be unlikely, but certainly you should be able to size the bike,
Okay.
get resting vitals, and at least get them through one stage.
Are we picking the intervention or?
You'll be kind of told what we're looking for.
Oh. Is there documentation? Sorry.
In that,
In the practice.
give me an example.
Like
At the end.
the
No,
sub note?
no,
Okay.
there's not enough time.
Yes.
Yeah, but wait,
There's more.
there's more. There's a care plan that we're doing where there is documentation that will count towards your grade. Remember, the first one, I let you slide.
Oh, the care plan's in class.
Care plan's in class.
Yeah,
Yeah.
That's on the-
But we're doing that same weekend. We're doing that on Saturday. Okay? Sunday is written exam, practical exam. Okay?
Is written exam cumulative?
It's primarily pulmonary. There'll be cumulative aspects of it, but not some small minuscule fact where I'm trying to trap you.
Okay.
Okay? But you can't brain dump.
No, no.
Yeah.
And then Saturday is also our group
Yeah.
presentations in the morning. and
So
then
Saturday,
it's-
I only have to do a little bit of lecture. I gotta cover modalities and suctioning. That'll be quick. So it's your ventilators. I'm sorry, not modalities, ventilators.
Will that be on?
Yes, it will be on the final.
Great.
I'm going to post that lecture stuff like tomorrow. So it'll be up there if you want to get ahead. Listen, do your readings. Pay attention in class, you'll do fine. Okay? So for that Saturday, it'll be ventilators, it'll be your presentations, it'll be case studies that we're going to do in class, and then your care plan that will be graded. And then you'll have some practice time as well. Okay? Sunday morning, written exam, just like we did this morning, but we're starting at 8. We have to start at 8, be done by 10, and then I gotta start your practicals. There's only 2 faculty members doing your practicals, which means there's 4 of you, and it takes about 50 minutes to an hour to get through each of you, so it's gonna be a full day. Okay? It's a long day.
You said 50 to an hour for each of us?
Well, if you figure there's 2 of you,
Oh.
right?
each-
10 minutes, 10 minutes, and 5 minutes of prep, it's 25 minutes.
Oh, so
Right?
it's not, so it's not 10 minutes intervention, then 10 minutes.
It's 10 minutes of exam, 10 minutes of intervention,
Okay.
and 5 minutes for prep work. So you are 25 minutes. Your classmate's 25 minutes. That's an hour. By the time you get out, in and out, that's an hour. So there's only 4 of you per hour. And there are, what, 28 of you? So do the math. It's a long day.
Yes.
You are not choosing your own partners. You will be assigned your partner, and you're going to be assigned your partner by random. I'm randomly going to put your names in a computer program I have, and it will assign who you go with. You will know that ahead of time.
Do we know the
Okay.
schedule ahead of time? Or like who was first?
Well, what you're going to, by the way, what you're going to know, and this is the fairest thing to do, is you're going to know your time. So maybe 1, 2, 3, 4. You 4 are at 10 o'clock.
We don't know where you're going.
You don't know who you're going with,
Okay.
okay? It's gonna be one of the 4, one of the 3, I should say, right? But yes, you'll know your time ahead of time, and I'm gonna just pick it randomly, so that's just the fairest thing to do, okay? Look, I've been doing this a while, and I think that's the fairest thing to do. Some people, oh, I wanna go further. It's gonna be random. You get what you get, and you don't get upset. I didn't say it that way, but if you want to choose to view it that way, that's fine. All right.